Alright. So we want to talk today about breast cancer screening. So there are three important questions we need to answer here. Question number one is why we are screening for breast cancer, most important thing. How should we screen for breast cancer? And when should we screen for breast cancer? And how often? So definitely we're screening for breast cancer to for early diagnosis and better prognosis, because the earlier we can treat and remove the cancer, the better is the prognosis. The second thing is how we're going to screen for breast cancer. Number one, we need to categorize patients into risk group. Average risk are those who have less than 15% chance of developing breast cancer in their whole lifetime. Moderate risk are those between 15 to 20, and a high risk are those above 20. So, who are average risk is the average population. Now, the moderate risk are those who have family history of breast cancer but no gene specific genetic diagnosis. They did not have any specific genetic diagnosis like BRCA gene or so forth. Now, is the more than 20% risk of breast cancer. Those are patients who have known genetic problem for that can predispose for breast cancer, like BRCA1, BRCA2, TP53, which is called Liframani syndrome, Putzger's syndrome, PTEN gene, which is hematoma tumor syndrome, and so forth. There are some genetics that carry a high risk, some carry moderate risk, and some carry low risk. So if somebody carries any of these genetic testing, they are high risk more than 20%. Now, in the how are we going to test now? What are we going to use to screen these patients? Of course, there is clinical examination, breast exam, like you do once a year breast exam with your physical with the doctor. The second is self-breast exam, your monthly self-breast exam. It's preferable at the end of your menstrual cycle, like when you have ended the menstrual cycle, you just finish your period. That's the best time to check due to the hormonal effects on the breast. The third thing is my most famous one is the mammogram, and then we have breast ultrasound and breast MRI. Okay, now coming to if you're a high risk, more than 20%, definitely the screening modality here is bilateral MRI of the breast. Mammograms is not enough to catch everything. Sometimes the lesions can be in line with the radiation field, so we don't pick it up. Sometimes patients have dense breast tissue that's not going to pick up some lesions on the mammogram. Definitely bilateral breast MRI. Now, those who are less than 15%, it's usually they recommend mammogram. Mammogram can be regular mammogram, digital mammogram, it can be tomosynthesis, the 3D mammogram. Of course, it's more sensitive than the regular mammogram. And sometimes we have to complement by doing breast ultrasound. There's no really guidelines that say breast ultrasound by itself is enough. It's of course less radiation, but not enough data. So again, we would categorize in those who are in average risk into age categories. Those below 40, usually there is no recommendations below 40 unless you had a significant family history of someone who got diagnosed at young age, or you carry any of those genetic risks, then you would move to the high risk, not the average risk. Now, under 40, usually no recommendations for screening, self-breast exam or annual breast exam with a doctor. And then 40 to 50, here the guidelines is markedly different. They say it's personal, like the Canadian guidelines versus American guidelines versus the European guideline. There has been some discrepancy. Say it's personal decision between patient and the provider, discussing her risk factor, discussing her lifestyle, making a decision if she wants to screen or no, and how often she likes to screen. Between 50 to 75, definitely must screen, definitely. And above 75, again, it's a discussion. If patients are very active, great lifestyle, they can still consider screening. Usually the guidelines stop at 75. Now, what about the guidelines of 50 to 75? Most of the Canadian, American, European says 2 years, but American Cancer Society is advocating for once yearly, and American College of Obstetrics and Gynecology are also advocating for once yearly, maximum every 2 years. The Canadian Task Force advocate for every 2 years, but maximum you can go up to 3 years. National Health Service in the United Kingdom advocates the maximum every 3 years. So the guidelines is don't definitely screen yearly. It's okay to screen every 2 years, maybe 3 years, but you definitely need to screen. The average consensus every 2 years. But as I said, American Cancer Society and American College of Obstetrics, they recommend yearly because of the risk of catching early tumors. I hope you found this video really useful. Follow us for further videos.